Hello, John. I'm studying. You know my notes? What's my notes? Hello, John Pancho. What's with this? I have exam tomorrow. Hello, Tarantula. Hi. You don't virus me anymore in my chat. You always look so beautiful. You don't, what virus? I sorry, Toronto, you don't visit me. I'm busy in school. Sorry. I'm just studying, doing college stream. I'll go to your channel if I don't have busy in school. It's okay. I'm sorry too. I will make time. Oh my gosh. Hello, Sharpnology. Hi. Oh my gosh, guys. You have an exam tomorrow, 160 items. So tired. Hello, Disimiwako. I think. Okay. Wala lagi. Status using physical contact. Thank you guys. I'm studying guys. Sakit akong tiyan. Payment and legal tender employee should receive their salary in real money or legal payment cash back transfer, etc. at least 2 times every month. Salary deductions are only allowed if the employee agrees, such as for SSS, PhilHealth, or Pag-ibig. Work hours and rest. Normal working hours are 8 hours per day. Employees should also have at least 24 hours straight rest after working for 6 days. Employment for women are protected by law. They are given 90 days paid maternity leave after giving birth. Hello, Joseph! What did you eat for dinner? Vegetables with soap and then scrambled eggs. Employment for women, so they are given 90 days paid maternity leave after giving birth. Employment of minors, the minimum working age is 15 years old. If underage ratio supervised from some minors who are literally goes in below. Safe working conditions. Employers must keep workers safe from accidents, self-organizations, workers have the right to join or create unions to protect their rights and discuss concerns with employees. Thank you guys. Self-organization, workers have the right to join or create unions to protect their rights. Employee compensations, workers who get sick or injured because of work may receive benefits like medical help, disability benefits, rehabilitation pensions, or funeral assistance. Thank you everyone for the 13 viewers. Thank you, guys. Hello, Fazvac. Fazvac. Hello, sis. Hello, Srinid. Hey. Super chat. Hello. 1,000 super chat. So hot, guys. Employee compensation, circular get sick or injured. Try na siya. Mga maka-receive siya o benefits. For leaves, vacation leave, employees can take. Oh my dear, give me tea. Hello, Fast Fact, Ice Cover. Thank you, everyone. Black clothes, Ice Cover. What? Thank you for the like. Did your presentation go? Yeah. The presentation is cancelled because it's study down. It's study day. I have exam tomorrow. Leaves. Vacation implies vacation usually 4 weeks per year. Sick leave implies leave and sick usually with a medical certificate. Parental leave includes maternity leave for mothers and paternity leave for fathers. Care leave employees may get 2 days leave for emergency involving immediate family members. Study leave, leaving for setting or training depending on the workplace needs. Duties and responsibility of a nurse. I'm meeting ice cover. What do you mean? Ice cover? Oh. Like, thank you, Sharp. Thank you, knowledge. Duties and responsibilities of a nurse. Direct patient care. Tasking or communities administer medication, receive and perform treatments ordered by doctors assisting in diagnostic procedures. Hello, Leonie. Thank you. Black rose on the ice cover. Thank you. Hello, Ben. I don't know what do you mean. Again. Forensic nurse is a help victims of violence or abuse, so siya mag-help sa mga violence or abuse. Thank you, Ben. Thank you, guys. Like and subscribe. Private duty nurse is provides one-on-one care for patients at home or long-term care. Thank you. Thank you, Lord. I just wanna thank you, Lord. Military nurse cares for soldier, military nurse educator, nurse entrepreneur, military business, flight nurse emergency. Independent nursing practice, self-employed nurses provide their services to clients. Unfair labor practices, you appear illegal actions by employers that violates worker rights. So forced labor, work done because of threats or fear, not by free choice. So ang forced yung mga pagpugos ng trabaho, the word forced. Salamat sa idol. Thank you, Ben. Alun di song son. Na na-duet sa natin siya. RA 11058 Occupational Safety and Health Law. RA 11058 requires employers to maintain safe workplace. 11058. Security of tenure, workers cannot be removed unfairly without proper process. Human work conditions. Workers should be treated fairly and with dignity. Cultural diversity means having people from different cultures, beliefs, ages, and backgrounds in one. Kasabot ni nila kultura, edad, background. Diversity is different cultures' beliefs. Different cultures or beliefs is diversity. Cultural competence, ability to understand and respect different patients, beliefs, and practices. Enhanced communication competence is ability to understand and respect different patients. Ability to understand. Cultural diversity means having people from different cultures, beliefs, ages, and backgrounds. Enhanced communications, good understanding between healthcare workers and patients. Increase patient satisfaction. Patients feel respected and understood. Reduce bias, diverse workplace reduce discrimination. Hello, Mr. Gray. My Gray. I'm doing good. How are you? Ato wala. Hello, it's all over.
Okay mga kapuso, Diyos ang nakay ninyo. Tulad na hindi pasabi ko ng piyansa niya sa tunang gobyerno. Okay, tay, kumusta mga gaganon? O sige, bakit hindi mo ka tunang piyansa rin?
Hola para camera. How long will your degree course take? I have only 1 year left. Why, sure? Kung maambot ng ganito, hello Marcelo, thank you. Hello Yuting Yuan. Maganda. Who? My gosh, guys. I have my stomach is hurt. Okay, a nurse working in a factory notices that the employees are not provided with masks or hand or chemicals which letter B or even 105 it is safety. A hospital nurse works for 12 straight days without a rest days due to staff shortage. Which worker right is violated? Does it mean beautiful? Yeah, it is. Maganda is mean beautiful. Hello, Michael. You had already written that in Portuguese. What? Hello, JB. Thank you, guys. Kumembot ng ganito. Gumiling ng ganito. Kumembot ng ganito. Gumiling ng ganito. Yeah. Oh my gosh, I have stomach ache. Guys, good luck with me tomorrow because I have an exam. Kenneth, hi. A hospital nurse works for 12 straight days without a rest day due to staff shortage. Which worker rights is violated? Right to self-organization, security of tenure, that is weekly rest period. A nurse was forced by the employer to continue working under threat of termination despite unsafe condition, not to be forced labor. Of course, in person. Which nursing rule is most appropriate for a nurse specializing in electronic health records and data management? Letter C, a nursing informatic nurse. A pregnant nurse is denied maternity leave by her employer. Which law primarily protect her rights? Then letter B, I 11210. 11210 kay expanded maternity leave. 11 RA 11210 expanded maternity leave. Which action by a nurse best demonstrate cultural competence? Respecting a patient's religious dietary restrictions. Which nurse is most likely to perform vaccination programs and maternal child assessment? Vaccination. Community health nurse. A nurse participates in evidence collection for a rape victim. Which specialty area in this? Letter C. Forensic nurse abuse. Care for victim violence. Which benefit include underemployee compensations? Housing loan. B. Funeral benefit. A nurse is terminated from work without due process or valid reason, which considered secure freedom of letter C. I security. Unjust dismissal. Security of tenure. Good evening. Hello, Krisa. Thank you, guys. Sorry, guys. I'm busy because hello, Luis. Hola. Hi. Hello, Luis. Oh, moderator you, Luisa. Pag-ibig mo na ang napili. Hello, Amta. Ang hananibod ko na suwi. At ang iyong tapili. Unanino na konjudayo yasinti. Yanado. Thank you, Shar. Your tananina nanan direction. Hi, Louis. Do you sing, Michelle? No, I have a bad voice. I don't know how to sing, but I want to sing. Tabinito and hanging asha diretso. Iwanin na lang kami sa aking puso. Oh, it's like me. Yeah! Nanindigo. Naninganandira. Oh my gosh, guys, I like my hair. I like your short. Short? I like my hair, guys. Like, it's wavy. But you're still singing. Yeah. But I have a bad voice. Napindiyo, tingnan nanin diretsyon. Di ka nananalosan sa aking puso. How is going in your exam preparations? Tomorrow is the exam. For for logic, it's 150 items, and for the one is 100 items. Tomorrow, guys. I like your videos. Good job. Yeah, it's so long. You know, guys, when we answer the exam, it's only 2 hours. I think 2 hours and 30 minutes for 150 items. And then the 100 items, I think 1 hour to 30 minutes. Or, I don't know. Sometimes magpanic ko. Sometimes I panic when the time is already, there's a minute left na lang, but then I don't finish yet to answer. I panic to shade because our exam is like a shading bitaw. It's like a board exam. Ganyan. It's shading. Sa aking puso. A nurse is terminated. Security. Good luck for your exam. Thank you, Shar. I will ace it. Ace it. Which healthcare worker would most likely require BOSH training? School nurse, occupational nurse, nurse educator, I think B. Occupational nurses are required to undergo basic occupational safety and health. Okay. Which situation best illustrates trafficking in persons? A nurse volunteer during trafficking. Through deception for letter C. Which leave is most appropriate for a nurse who needs time off because her child was hospitalized unexpected? Hello, Leonie. Thank you. Which leave is most appropriate for her child? Be care leave. Which nursing field focuses on emergency care during patient transport? I'm sorry, I'm talking English. It's okay, Louise. Hi, my beautiful friend. Hello, Lindsay. Sharo Randy. Which nursing field focuses on emergency care during? Letter D, a flight nurse. A flight nurse provide. Which action by an employer is considered an unfair labor practice? Providing overtime pay, allowing maternity leave, preventing employees from joining unions. That is, employees have the right to self-organization in unions. A nurse entrepreneur most likely works on the hospital owns a letter D. Which statements about cultural diversity is true? Diversity includes religion, gender, and diversity includes cultural involvement characteristics beyond race or ethnicity. Which worker is protected RA 7277? B. I'm working with disability. Which nurse commonly perform injections, dressing, and assist in physical examination? Which nurse commonly performs injection? A. Clinical nurse. A hospital implements ramps and elevator accessible for wheelchair users. C. A 344 PP building. The accessible law requires facilities to be accessible to persons with disabilities delegate RAIBP BLG 344 for disabilities, which is the best example of enhanced communication in culturally diverse healthcare that will be using interprets. Which nurse specializes in one-on-one long-term patient care at home? Private duty nurse, which practice legal regarding literacy. Which nursing will primarily focus on teaching future nurses? A nurse educator. Which SDG goal emphasizes decent work for all? Which nurse is most likely assigned to review an ICU period? A hospital nurse. A worker is threatened with violence if he refuses to work overtime without pay. Which element of forced labor is present? C. Ebi. Creates elements of forced labor. Which benefit of diversity improves employee satisfaction? C. Ebi. Sumali, oy. Inclusive workplaces improve retention and employee morale. Unsa daw nagabi, which benefit of diversity improves employee satisfaction? Which nursing field requires military training before military? A nurse takes leave to attend graduate school classes sa provider ba? Touch. Touch is using physical contact to show care, comfort, support, and reassurance. It helps using the motion distance. Example, a nurse gently holds a patient's hand before surgery to help the patient feel calm. Hello, Tanya. Oh, I'm doing good, guys. Example of nonverbal communication. Silence means not talking but still showing feelings or support through quietness. A silence touch is means using physical contact to comfort or support a patient. Facial expressions, eye movement, body postures or body positions, assess personal beliefs or person from different. Nurse should respect different cultural beliefs and avoid judging patients. Nurses respect a patient's traditional healing practices. Assess communication variables from a cultural perspective. Culture affects how people communicate, so nurses must understand cultural difference. Hope you had a great day. Hello, David! Ah, hi! Wala na si Super. Wala. Ikaw? Si ante? Sana sinabi mo, di ka po'y naman kuno ko. Ha? So, di na wala nakansil. Wala lagi nakansil. Kapoy ang mama. Sa balik-balik. Pangutan na dito mo, maestra. Anong wala ka palit-palit? Ha? Yung na mo siya cancel. Mana-report ro. Naon sa di ka ma. Hello, Sharp. Thank you, guys. Sige ka. Uy, naku po. Facial expression. Applications of nursing care, body postures, and lectures of body positions. Hello, Alex. Ako yun mo. Sige mo kung mandot. Ay, basa mo. This refers to the body position of facial figure digits. Applications to nursing care assess personal beliefs of persons from different cultures. Assess personal beliefs. Nurses should respect different cultural beliefs and avoid judging patients. Assess communication various matters. Culture affects how people communicate, so nurses must understand cultural differences. Key idea, effective nursing care requires self-awareness, cultural understanding of patients and their communications. Nursing care should fit the patient's beliefs, values, and cultures. Validation means checking if the patient understood the instructions correctly. A nurse asks the patients to repeat medications instructions. Be sensitive with sexual health topics. Some patients feel shy discussing sexual health, so nurses should be respectful and professional. So a nurse discusses reproductive health privately and confidently. Communicate with patients norms. Cultural norms are behavior considered normal or acceptable in a culture. So for Philippines, hindi naman. Kaya di what is the normal norms are moral versus different societies or laws are formal reasoning. Folkways are commonly repeated behaviors of a traditional government and styles. Rituals are similar to cultural transmission or culturations, learning your own culture from family and community. Katong sa kagaling kultura dito sa pamilya. So, enculturations is learning your own culture. Okay. From family and community. Acculturations, learning another culture after living or interacting with another group. Learning another culture after living or interacting. Acculturations, living. Assimilations, completely adapting to another culture or using the original culture. Ang assimilation is adapting another. There's someone outside the room. There's no. Really? There's a ghost? Pwede po ba pa-shout out ako? Hello, Fatima. Really suya ko nga. Thank you po sa shout. You're welcome, Fatima. Sagi! Oh my gosh, guys. Assimilations, completely adapting to another culture. So, adapting another culture. Or losing the original culture. Completely adapting to another culture and losing the original culture. Oh my gosh, guys, my head is hurt. So many. Immersion is learning culture by fully experiencing and living. Immersion, kaya pagka culture can be learned in different ways. So, culture inculturation style, learning your own cultures by from family or in the community. Ang acculturations, learning another culture after living. So, mag-learn ka another culture after mo nag-live ka there or interacting with another group. For assimilations, is adapting a new culture, adapting to another culture and losing ka. Mag-adapt ka another culture, then mag-lose mo to ang original culture. For immersion, experiencing with it or living with it. Cultural differences. Every culture is unique and different. Ethnocentrism, believing our own culture is better than others. So, nag-believe na siya nga, imong culture is better than the others. Xenocentrism is believing other cultures are better than your own. Kapag ito nga, mas maayo ang kultura. Xenocentrism is opposite for ethnocentrism. Ethnocentrism kay you believe that your own culture is better than the others. But xenocentrism is you believe that the other culture is more better than your own culture. So, libog. Nurses should respect cultures equally. Prejudice. Negative feelings toward the person or group without knowing them well. So, prejudice is negative feeling toward the person. Ang seno. So, ganitong seno, believing other culture. Believe other cultures are better. Believing other cultures are better at not or believing. Thank you, Sharp. You're still here. Another. Stereotype, assuming that all people in a group are the same. So, you assume that all people are the same, which is stereotype. Prejudice is negative feelings toward a person or group without knowing them. Discriminations, treating someone unfairly because of their culture or background. Alala yun eh. Thank you, guys. Discriminations, treating someone unfairly because of their culture or background. Prejudice is feeling. Stereotype is your belief. Discrimination is action. So, prejudice is negative feelings. Ang stereotype is assuming all people in a group are always the same. Assuming all people, discrimination is action. Types of prejudice. Racism. Discrimination based on the race or skin color. Racism is discrimination based on gender. The word sexism is based on gender. Heterocism, discrimination against LGBTQ individuals. So, discrimination of LGBTQ, heterocism, sexism, discrimination of the gender. Racism is for the skin or color. Classism, discrimination based on social class or law. Discrimination for classes, wealth, or the word classism. Linguism is based on the language or accent. Age, against older group because of the age. Racism based on the physical appearance. And then, make a 20 question. So, a nurse caring for a patient from a culture or avoiding eye contact is a sign of respect. Which action by the nurse is most appropriate? A nurse says patient to use traditional healers if used to modern medicine. The statement thus illustrates the stereotyping. Of course, no person generalize a whole group. Studying is yes. Stereotypes, of course, when a person generalizes a whole group of nationals. I want to sleep. A Filipino nurse working in the United States begins adopting American workplace practices while still better the acculturations. Which nursing action best demonstrates validating of communications? Using medical terminology, repeating instructions louder when the patient is confused, asking the patient to repeat. Letter C. Validating. A nurse remains quietly seated beside the crying patient without speaking, which non-verbal letter B silence. A nurse believes that Western medicine is always superior to traditional healing methods. This belief is an example of a nurse believes that Western medicine is always superior. Seno. Etno? Is believing one's own culture. Etno. A patient speaks very little English. Which intervention by the nurse is most appropriate? Use professional interpreter. Which behavior by the nurse reflects a patient diet? Nurse learns the the adultery, the immersion, which situation does demonstrate discrimination? C. Which statements by the nurse demonstrate cultural sensitivity? Your beliefs are incorrect and unsafe. You must. Can you tell me when mention your choice? For nurse seek to understand the patient's beliefs and perspective. Nurse seek to understand. Cultural sensitive is to seek to understand the patient's belief. I have to study, myocardial infarction. My gosh, I'm not finished yet. A nurse asks a patient, how have you been feeling lately before discussing personal conditions? Nikki, 14. A migrant completely adopts a new culture and no longer practices their original traditions. This process is assimilation. Which action best reflects active listening? Interrupting, living in the church. C. Nodding apparently. A nurse think foreign healthcare system are always better than local. B. I ethno. Other culture. Which of the following is best example of a ritual? Saint Paul or traditional quotes daily? Letter C. A nurse assumes all adolescent patients are irresponsible and Hello, people! This is an example of a nurse assumes all adolescents patients are irresponsible. D. Valid stereotyping involves generalizing about a group of concerning. Which nursing intervention is most important when discussing sexual health? Using murder. Provide privacy. Okay, done. So, paano ta? Hello, I'm doing good. This is an example. Primary level is refers to the implicit rules known and followed by members of the group now. Tertiary is visible part of cultural outsider. Secondary underlying assumptions are known members of the group but clearly showed with all. Ang secondary career is short. Hello, Gaffer. How are you? I'm doing good. Kanang earlier siya. Primary, it refers to the implicit rules known and followed by members of the family. Secondary, tertiary. Theory of culture, diversity, and universality. Focuses on describing, explaining, and predicting nursing similarities and differences. Focus primarily in human care and caring in human culture. Explanation theory of culture care. Diversity. Goals of Transcultural nursing. According to Linger, the goals of transcultural nursing is preserve or maintain culture, provide culturally congruent care. The three modes of nursing decisions and actions is culture care preservations and or maintenance, culture care accommodations and or negotiations, culture care repatriating or distracting. Primary level is just deepest level. This is the deepest and strongest culture you can learn first from birth, your family, home, and earth environments from which it's here. And then secondary is social. This comes from school, friends, work, religions, and community groups. Tertiary is mass global. This is the culture, influence of media, technology, and globalization. Hi, love. Very good. Hello, Joanne. Hi, sir. Hi, Cesar. Yeah, I'm Filipino. Goals of so the three models, so culture career application negotiation, culture career paternity. Giger and David, Giger and David, Hizor, transcultural assessment model. Giger and Ato developed to assess cultural values of patients about health and disease behaviors and their effects. The model contains cultural dimensions, communications, time, space, social organizations, environmental control, biologic bar. This model assesses patients' culture in a structured by way to become more efficient. Communication of person senses, space, construction, religions, time, regulations. Custody, space, social organization, time, cultural, biological variations. Panel model. Andres Boyle Campino. David, yeah, she is the super chat. She is super chat. What are you reading, Bible? No, I'm studying ano for our school. Yeah, medical. So you grade young. Thank you, David. Slavisa, hi. Thank you, guys. Thank you, guys. I'm still studying, guys. I have exam tomorrow morning. Pornal, model for cultural competence, helps nurses understand the patient's culture using circle system that focuses on seeing the patient as a whole person influenced by culture. Take care, I gotta go. Okay, okay, Jan. Thank you so much. She will get help from you when my channel gets monetized. We'll be helping others with the one million. Thank you, David. What? Are you perfect? Zealous? Oh my gosh. You're just a dump account. You have to, when you're basher, you have to show your real account. Your main account, not a, see, you're just a dump account. Thank you, David. Okay, sensitive. Thank you. Oh my gosh, guys, di na siya masod sa utok, guys. Anaw na lang ako ni siya. Sod na lang ni sa ulo. Kaligo. I have to take a bath. 12 cultural overview, heritage, communication, family rules, organization, workforce, issues. So, a patient refuses pork due to religious belief, nurse adjust a diet plan. Mana siya ang panel. Help nurses understand a patient culture. An outline to classify and arrange elements that have an effect on the culture and individuals. It's applicable to all healthcare providers. The panel includes 12 domains, overview of heritage. Yeah, okay. Andrew, Andrews and Boyle transcultural nursing model. Just keep studying yours. Thank you. I'm not smart, kaya. This model emphasizes cultural assessment, culturally competent care in nursing practice. It focuses on understanding how culture affects health, beliefs, illness, and care decisions. Culture strongly influences health behavior, and nursing care must adapt. Yes, David. Because you'll be mental block, guys, if you don't eat. Right? This model emphasizes cultural assessment, culturally competent care in nursing practice. It focuses on understanding how culture affects health, beliefs, illness. Culture strongly influences behavior, so cultural assessment, communication patterns, health beliefs, and practices, family environment, society. A family insists in a traditional healing first, nurse first, doctor first, while still giving medical care educations. Ano siya? Campina Bakut model. This model sees cultural competence as a continuous process, not a final goal. It's a journey, not a destination. Cultural awareness, understanding your own beliefs and biases. Cultural knowledge, learning about other cultures. Cultural skills, ability to assess cultural needs. Cultural encounters, direct interaction with different cultures. And then genuine willingness to be cultural competent. Learns about practices. So Pernal is a 12 cultural domains, holistic view of cultures. Unreasonably a cultural nursing care, culture affects health and care. And then process model, culture to studies. Puno culture, completely or whole system. Apply culture nursing category. A nurse assess a patient's communication style, family rules, nutrition, spiritually, and that rituals which model is being used. C. IB, Purnell model includes 12 cultural domains. Purnell model, you're right, David. Yeah, some ladies are dieting because they're conscious of their body. Eh. Hello, Pink! Oh, mag-ano kumain? Oh, may pagkakas. Hello, how are you, Pink? Tell me, Katsy, Katsy. which best describes company Habakkuk's model. Reflects on culture as a continuous process. Letter C. A nurse reflects on personal bias before caring for a patient from another culture. A nurse reflects on personal bias before caring. The cultural awareness involves self-examinations of life. I'm good. How are you? I'm doing good too. Go to sleep. Yeah, I will not go to sleep because I have to study. Each model uses 12 domains of culture. See Porno model. A nurse learns about Muslim fasting practices before providing care. This is B. Knowledge. Which model emphasizes cultural assessment and culturally competent nursing care? A. Andrews focusing on nursing assessment and care. Adaptation. Si Pernell nag-focus siya sa culture. Si Andrews nag-focus siya sa care o sa health. Si Kompantay, mga 5 encompassing concept culture. A nurse really interacts with patients from diverse backgrounds to improve skills. This is cultural encounter. Interaction with patients. Which component is the most important motivator in company? Is the most important motivator? Be desire. A patient refuses pork due to religious belief. Which model help nurses assess his holistically? A. Pernell. A nurse assess how a patient's culture affects illness, beliefs, and family decision making. This reacts is A by I Andrew Boyd's culture affects illness and family decisions. I'm not. Which model states cultural competence is not a destination but a journey? Which is not a destination. B company. A nurse learned about her own stereotypes before interacting with patients. This is B. Awareness. What do you mean? Which model is most holistic and system-based? A. Pernell covers 12 interconnected cultural domains. A nurse demonstrates cultural competence by adjusting communication style and patient culture. This is skill, which is not Thank you, Sharps. You're still here. Kapoy na ko guys, I'm so tired. So we're done in the transcu, so we're done in the myocardial infarction. Causes of myocardial infarction, the muscle suddenly lack oxygen. So ang imuhang heart, dili siya makareceive og oxygen, mana siyang ginatawag ischemia. Insufficient blood flow to the tissue. So gamay ra nga blood flow sa imong tissue, the word ischemia. So too little blood reaches the heart tissue. So too little blood ma-reach dito sa imong heart tissue is ischemia. Coronary artery disease. Fat and plaque build up in coronary arteries. The blood vessels of the heart become narrow because of fat deposits. So, coronary spasm. Temporary tightening of coronary arteries. The artery suddenly squeezes or tightens, reducing blood flow. Atherosclerosis, hardening and narrowing of arteries. Plaque and cholesterol make the arteries hard and narrow. Risk factors of MI. So, hypertension. High blood pressure damages blood vessels. Strong pressure inside blood vessels can damage them. So risk factors is hypertension, high blood damages, strong pressure inside. Stress and anxiety makes the heart work harder. Too much stress increases heart workload. Thank you. I've really made it to heaven. Hello, Snacky. Snacky. Sorry, Snacky. I'm so busy, Snack. No. Tingnan nga, di na siya. I'm reading I have an exam tomorrow. Thank you, Alan. It's all about myocardial infarction. I have 150 items exam tomorrow, please. Hypertension. Oh. Sa isa na ka subject, pero itong pareha sa una, may exam yung balo. Oh. Balo. Di ka fourth year. You look extra fine today. Really? But, I don't know. High blood pressure so damages. So, mga risk factors of myocardial infarction is hypertension, stress, and anxiety. So, makes the heart work harder. Too much stress increases heart. Age and genetics. Older age and family history increases risk. Older people or those with family history of heart disease are more at risk. Smoking and diabetes, damaged blood vessels and heart. So smoking and high blood sugar weaken the heart and arteries. Then you have the diagnostic test for MI. So what's the mga So for cardiac markers, the first is troponin. Released when heart muscle is damaged. So troponin increased in the blood when the heart is injured. Other side na. Ba't lang? 60 na. CKMB is specific marker for heart muscle injury. So this blood test helps confirm heart damage. So CKMB, siya ang mag-confirm if you have a heart damage. CKMB. So first one is troponin. Troponin increases the blood when the heart is injured. Then CKMB, the blood test help confirm if there is heart damage. Myoglobin is protein released from damaged muscles, releases quickly and after muscle injury, but not only from the heart. Myoglobin, protein released from damaged muscles. The WBC contact vessels increases after electrocardiogram. ST segment elevation meaning STEMI, which is ST elevation. And then shows a severe heart attack on ECG. Mo na siya ang... Yes, I will tell her. Thank you, Sharp. Thank you for coming here. Always. Thank you. Take her, Sharp. Thank you, Snacky. Thank you, guys. My gosh, nagbibo na. So, STEMI is, there's an elevation of your, naman na di ba, for ECG guys, echocardiogram, there's sa imong heart. So, mag-ano kayo na siya, there's a STEMI, man na siya ang severe, kay elevated ang imong, basta elevated na siya, severe heart attack and ECG. T-wave inversion indicates reduced oxygen supply to the heart. Symptoms of myocardial infarction, and also STEMI guys, kay nana siya totally blockage sa imong coronary artery. That's why mo elevate na siya ang imong ST segment elevation kung mag-test ka o electrocardiogram, which is ECG. Next, symptoms of myocardial infarction. So you will feel chest pain, shortness of breath. You will chest pain, I think. Wait, I have notes of this one. Breathe in. Hindi siya makita. So, causes blockage of the coronary artery spasm, auto supply. So, signs and symptoms is crushing substernal pain, acid, so radiating chest pain to the arm. So, chest pain siya first. Then, mo radiate na siya, hallucinate, and mo radiate na siya sa mong arm, and then jaw, and then from your back. That's why if you have good evening, Sir Nathan, if you experience guys chest pain nag-radiate to your arm, to your back or jaw, you may feel you have a myocardial infarction. Then Dili siya ma-relieve sa nitrates rest. Shortness of breath, so you will have difficulty breathing. So, imong heart rate kay elevated, which is high imong heart rate, then high imong blood pressure, and then irregular heart rate po. Of course, occurs early in the morning. More. Jackie! Oh my gosh. And then, for diagnosis dun siya kay troponin 1. So, protein increase to dayon, CKMB, then hemoglobin. Sakto ra siya guys. Many mono-release 1 and ECG STEMI, ST elevation, T-wave, and STEMI, Q-wave. For nursing intervention, guys, so what would the nurse do? So, we have to assess chest pain. So, the priority of this, we have to the airway, ABC. Airway, LQB, airway, breathing, and ABC. Ito ito, ABC. Lagi ABC, airway. Then, continuous cardiac monitor on bedside. So, nado dapat cardiac monitor in the bedside. Provide O2, which is provide oxygen. Via, then IV access, strict bed rest. Then position the patient in a semi-fowler position. So how would you position semi-fowler? So magana siya guys. Magana siya. Monitor respiratory sounds. Crackles. So monitor respiratory sounds, respire sounds. So there is crackles in your lungs or in your heart. Then pulmonary edema. Yeah, in your lungs. That one. Sasakto dun siya, shortness of breath, dizziness, cold sweat, or nausea. Atypical symptoms, women may feel tight in digestion between early and diabetics. They may not feel chest pain. Management is for, guys, for medications. When you have heart attack or diagnosed with myocardial infarction, the first medication that the doctor will prescribe is antithrombotics. I don't know. It's mabuni siya ang gold standard. I don't know if this is the gold standard. Aspirin or clopidogrel. Clopidogrel. Aspirin, guys, it is the antiplatelets. Because you have an blockage or blood clot in your coronary artery disease. So that's why aspirin, because it is antiplatelets. Arterial clots from it prevents platelets from sticking together and avoids clot. Aspirin to avoid clots na siya. Anticoagulant, antiplatelet. Then we have the interrupt clotting factors or protein in the blood to the prevent. Heltristat, warfarin, heparin, apiraxamine, rivaroxamin, doxy. Then we have the morphine for chest pain. When we feel chest pain, so we'll prescribe morphine. IV route. So IV route siya, diri siya sa imuhang arm. There's an arm. And then for nitrates, nitroglycerin vasodilator, the ACE inhibitors, beta blockers, low BP, then low HR beta blockers. ARBs is use of patients cholesterol so that. Muna siya, ang monatas, morphine, oxygen. I'm doing good, Tristan. Morphine, oxygen, nitrates, aspirin, probolantex, antiplatelets, stool, and sedative. So, more na to siya, guys. Oxygen, ito kasi aspirin, beta blockers, ACE inhibitors, relax. Procedure for MI. Percutaneous coronary interventions, abolition. So, mga procedure, guys. Procedures for MI, like it's a surgery that Rule 2, percutaneous coronary intervention, which is PCI. So there's a balloon or stent. Mo-open is to use to open your blocked arteries. Mana siya, para mo, ang imong blood flow sa imong coronary arteries, kay mo, paano siya? Ito, ano, coronary artery bypass, grafting. The word bypass is to create a new pathway to blood flow. Heart failure. So next, we have the heart failure. Heart failure happens when the heart cannot pump enough blood to meet the body's needs. The heart becomes weak and cannot pump blood properly. So happens when the heart cannot pump enough blood to meet the body's needs. Causes of heart failure, coronary artery disease. Reduced blood flow weakens the heart, hypertension, high blood pressure. Tigig po din buang. Hypertension is high blood pressure, makes the heart work hard. Myocardial infarction, sad. Valvular heart disease, damaged heart valves affect blood flow. Pulmonary hypertension, high pressure in the lung. So there's two types of heart failure, the left-sided heart failure and the right-sided heart failure. So left-sided heart failure, it is lungs filled with fluid. So symptoms for that is the word lungs, dyspnea, crackles, pulmonary edema, fluid in the lungs, right-sided. Arrhythmia, nocturnal person of dyspnea. Right-sided heart failure, right-sided heart failure is weight gain, so the body filled with fluid, the rest of your body. Jugular vein distension, ascites, splenomegaly, hepatomegaly, yeah, enlarged liver. High output of heart failure. Hello, Paul. Oh my gosh, guys, kikapoy lang. The heart works too hard because the body needs extra blood. Symptoms of heart failure, shortness of breath, isip pag ginawala binakmuli. Fatigue, the body lack oxygen needs blood. Wala ko na God. Uy, my gosh. Out na kumain.